Hi everyone, welcome to my channel Nursing Simplified. So let's look at what is nursing process. Nursing process. Nursing process is a systematic and step-by-step method used by nurses to assess their patients, identify what is the problem, and also then to plan care. Once you plan the care, you will provide the interventions and then evaluate the outcomes. Now it has got 5 steps. Okay, so we can remember the 5 steps using the acronym ADPIE. Okay, so let's move on to the first step, which is the assessment. Okay, so assessment is where you will assess your patient, and this is the first and the most important step. Here the nurse will collect the information about the patient, and this will include collecting the health history of the patient, the physical examination, taking vital signs, checking the lab reports, and also patient's verbal complaints also will be considered in assessment. So assessment itself has got 2 different kind of data. The first one is subjective data, and the second one is objective data. So subjective is what the patient states, like for example, I have pain, I'm not feeling well, I feel dizzy. These are all patient stated statements, so these comes under the subjective data. And objective data is what you observe. You observe that the patient is lethargic, you observe that the patient is weak, you observe that there are bruises. You observe that the BP is low. So these are all objective data. Okay. Next step is, this is the first one. The second one is diagnosis. Now, this is nursing diagnosis. In this step, we will analyze the assessment details that we have gained, and then we'll arrive at a nursing diagnosis. And nursing diagnosis is not same as that of medical diagnosis. For example, medical diagnosis might say that the patient is diabetic. Okay, so we as nurses, we will follow the Nanda nursing diagnosis. Okay, Nanda nursing diagnosis, and then we'll define the diagnosis, or we will put the diagnosis as mentioned in this Nanda nursing diagnosis. Okay, so when the medical diagnosis is diabetes, there can be so many nursing diagnoses. One among that will be impaired skin integrity or the risk for infection. Okay, now when we say that, it means that the nursing diagnosis focuses on the patient's responses and not on the disease. Okay, hope it's clear. Now, step 3 is planning. So here it means that you will set goals and outcomes for the patient and then decide what nursing actions are needed. Okay, so these goals should be SMART. When we say SMART, it means it has to be specific, it has to be measurable, it has to be attainable, it has to be realistic, and also time bound. Okay, for example, when we say patient will maintain normal blood glucose level within 24 hours. Now, this has all the components. It is SMART, it is measurable, because we are saying normal blood glucose and we are being giving the time frame, which is 24 hours. And it is achievable because it is 24 hours. Okay, it has to be realistic. We can't just say that within 2 hours and 3 hours. It might not happen. So when we give a longer and realistic time frame, it becomes more achievable. And step 4 is implementation. Implementation is where you put your plans into action. Okay, so in this step, what will the nurse do? Here we'll give the medications, we'll perform the procedure that we have mentioned in planning. We can also provide patient education, and also we can assist with daily activities. So here basically all the planning steps you're putting into action. Okay, so then the next step and the final one is evaluation. In this step, this is the final step, and here the nurse will check whether the goals are met or not. Okay, now if the goals are met or achieved, care can be continued or stopped. If the goal is not achieved, the nurse will reassess and modify her plan of care. Okay, so this makes the nursing process a continuous cycle. So this is how a nursing process looks like in a tabular format. If you have any questions, please feel free to put your questions in the comment box. Thank you.